No one really knows how many people call Kibera home, the biggest urban slum in Africa and one of the biggest in the world. The 2009 census suggesting that almost 170,000 people are living in this area, but estimates are suggesting that almost 500,000 people live in this slum. The massive Kibera sprawls out in front of us, a sweeping valley of rusting, corrugated, dilapidated settlement built from material cast off by the rest of the city. From far, it looks peaceful and quiet until you get close and witness this robust economy, which accounts for less than 1% of Nairobi's total area, standing at 684 square kilometers, while holding more than 25% of its population, according to the Human Rights Watch report. No formal systems of clean water, proper roads, sewage lines, sanitation and healthcare exist in these parts of Nairobi. It nonetheless houses tens of thousands of Nairobians who cannot afford decent dwelling. With all this myriad of challenges, disease is close to inevitable. Controlling it is also another nightmare. Along the road before arrival at the vast slum are a number of establishments that treat the who is who in the society. This notwithstanding, the country's largest referral hospital is at the advantageous proximity to these residents. However, their hope to access to quality healthcare remains a mirage. The residents are left at the mercy of an all-important network of Kenyans who have established their activities within the slum. They wear t-shirts with health messages, carrying a bag containing tablets, syrups and health information materials. They go door to door, crisscrossing the villages on foot, discussing the health benefits of family health. We are talking about community health volunteers. Sarah Kinyi has been living in Kibera for close to a decade now. She knows very well the centrality of the volunteer medics.
Kitambo ilikuwa mbaya juu unapata hadi mtu anaweza kufia kwa nyumba juu ajui venye ataenda usi, na sasa unajua wakiwa ni kuitwa tu, wataitwa na wakuje.
Asha Hassan has lived in Kibera for 19 years, 10 of which she has worked as a community health volunteer. Hassan cites the struggle women and children in this area have contended with towards accessing quality healthcare.
Tumechange vitu mingi sana. Saizi huwezi sikia huku Kibera mama anajifungulia kwa nyumba, huwezi sikia mtoto amedefault, huwezi sikia hata wa bedridden wamekufia kwa nyumba. Ama tunafanya follow up na tuna make sure hata huyo bedridden tunaenda kumwangalia mara kwa mara, kama ni wakupeleka hospitali tuna make sure tumemfikisha kwa facility.
One of the beneficiaries, a middle-aged mother of a 4-year-old girl who wished to remain anonymous, knows this too well after the services she got through prevention of mother-to-child transmission program.
Alikuja kunitembelea kwa nyumba, akaniambia naona nikao kwa mjamzito, umeenda clinic? Nikamwambia bado. Venye nilienda kwa clinic, ukikapatikana ni mimi niko positive. Time za kudeliver, nikadeliver and thank God kupitia kwa yeye nilideliver mtoto ako negative and now she's 4 years old. Yeah, so kama hawangekuwa hawa CHWs, unaona mimi singejua ni nini inaendelea na nini ninaweza fanya. Koza alinipatia morale, akaniambia unaweza pata mtoto wako negative. And then kutokea kwake nimepata mtoto wako negative. Hawa watu wenye wanakatanga kujikubali ndio hao life yao wanga inaenda haraka. Unaona like mimi venye nilikuwa nimekaa stress mingi singekuwa.
This program has been a success since its launch in 2005, according to Daniel Kavo, the head of Community Health and Development at the Ministry of Health.
It has actually given us a lot of evidence and proof that community health works and works quite well. Because in the counties and in areas where community health is vibrant, like the areas of Kibera you talked about, we have not had cases of cholera, because of the simple measures of prevention that they have put in place to prevent some of these diseases.
Universal health coverage subject dominated the 71st World Health Assembly in Geneva, Switzerland, with Rwanda leading the way, perhaps the only African country where the implementation of this global priority succeeded.
Community health workers and good external partnerships led to the steepest reductions in child and maternal mortality ever recorded.
Return on investment in community health is undeniable, research indicating that economic value gained from the program is greater than the cost of implementing the program.
We did a return on investment case, which we concluded, and we are at the point of actually rolling it out or disseminating the information. And we realized every 1 shilling we use, we get 9.4 shillings back.
Since inception, the project, though initially successful, has witnessed a number of setbacks, including a number of CHWs stopping their development due to lack of support.
Although it's a policy of the government that essentially at least every community health volunteer should be given a stipend of about 2,000 Kenya shillings, but we have not been able to give all the community health volunteers the stipend.
Sisi ndio tuko katika ground, tuko katika community, na ile impact tumefanya, tunaomba serikali at least wa recognize. In fact wana recognize, but kuna kitu moja ambayo hawafanyi, kale ka motivation. At least tukipata ka payment hivi end month na ka payroll, itakuwa mzuri sana.
Given its impact, the sustainability of the community health volunteers model is an issue Kenya must address as it looks to consolidate and build on recent improvement in family medicine and universal health coverage. Onyango reporting for Talk Health on KUTV, Nairobi.